Next, I'd like to talk to you a little bit about what I think is the best way to put airQ in. It's a very easy airway to insert. First, I'm going to talk to you about the standard LMA technique that's used by anesthesiologists. Usually when they grab a laryngeal mask airway, they put their finger on the back, and this is called the classic insertion technique. And they put the airway device on the hard palate and push with the index finger and try to roll it around the corner. If you've been taught that, you don't want to use that method for airQ, because what happens is, because airQ is built differently, you'll push with your index finger and you'll bend the mask backwards on itself. It makes the insertion very much more difficult and traumatic, and you won't be able to ventilate the patient very well because it'll be sitting in the pharynx like this. Instead, what we're going to do is we're going to put the head in extension if we can. It's not totally necessary, but it makes it easier. So if you can move the head back, that makes it much easier for the insertion. We're going to lubricate the airQ like this. I usually lubricate the entire back and the cuff and the little ridges. We're going to tilt the head back. If you can get a tongue depressor, I usually like to use a tongue depressor to lift the tongue. You want to put the airQ in on a forward angle if possible and shoot for the back of the tongue and the soft palate, sort of the hole, if you will. Once you get in there, I like to sort of twist it in a little bit and see if I can get it going. Once I get it around the corner, I usually drop the tongue depressor and lift the mandible, and I push with my index finger on the top of the connector and support the tube with my other fingers, sort of in a pull and a push technique. Now, this is really easy to learn, doesn't take very long, and it's very effective. Now, if airQ on insertion goes in and gets stuck and won't go in, all I usually do is put my finger behind the mask. You can either put it in like this, or you can put it in with the knuckles toward the feet. I use the knuckles toward the feet technique, and help the airQ around the corner like a shoehorn. So just help it around the corner and then lift the mandible and slide it in. It's extremely easy to do. Practice this a few times and you can do it quite simply. What I'd like to talk to you about now is the best way to inflate airQ. I get this question all the time: how much air do I put in the device? I think the best answer to that is I use what I call the red tag on technique. This tag opens up the pilot balloon valve, so it opens up the intracuff to air. So if you squeeze the cuff, you blow air out the back of the device through the open valve. Now, as I place the airQ into the patient, the tissue of the pharynx will start to fall down and decompress the airQ cuff slightly. So there'll be an equilibrium between the cuff being inflated, partially inflated, and the tissue folding down on top of the airQ. So by the time you insert it completely, the tissue will partially deflate the airQ, and so it will size itself and get the shape about right. So what you have left is an airQ in the pharynx with approximately the right size and just about the right amount of air. So you don't have to put much air into the airQ at that point, just a little bit. Now, how much is that? So once we get the airQ in, I usually take the red tag off at that point, and I put just a little bit of air in. How much air is usually about the same size as the airQ device. This is the medium adult size, which is size 3.5. So in this airway, I would put in about 3 or 4 cc's of air. With the large adult size, which is the 4.5, it would get about 4 or 5 cc's of air. So just a little bit amount of air. The more air you put in, the less efficient the airway will work, because it will make the cuff too stiff and it change the size and the shape of the device. So if you use the air tag on, it will allow the patient in the airway to size it up for you, shape it up for you, and all you have to do is top off the balloon just a little bit. Once you get the airway in and you get the inflation proper, then you want to check the ventilation. So put your little bag onto the airQ device and try the ventilation. And check it, make sure that you can use positive pressure ventilation to ventilate the patient. If you don't have a proper amount of seal and you want to increase the seal, don't put a lot more air in it. What you want to do at that point is back up the airQ just slightly. Because sometimes, especially when people first learn how to use airQ, they'll put the airQ in a little bit too deeply. They get a little aggressive and they shove it in there too deep. So sometimes you just want to back it up physically and put the cuff, that heel of the cuff, back into the vallecula so it can seal up the base of the tongue and the vallecula more efficiently. That usually will do it. So there's sort of 3 things to do. Leave the red tag on, put little bits of air in, and back up the airway if you need to. You only need to back it up just a little bit, maybe 1/4 to 1/2 inch at most.